Hello. Welcome to SalivaCast, the podcast where we translate the science of saliva into practical insights for clinical dentistry and health. My name is Deborah Heller. I am a dentist, a scientist, and a professor at UT Health San Antonio in the United States, and the founder of Saliva Pro and co founder of Saliva Pro Sports. For the past, how many decades? I would say almost 3 decades. My work, my life mission has focused in one central question and one central mission, which is how can saliva help us move dentistry? And you see today with me that this goes beyond dentistry. It can actually, how can saliva help us move healthcare from reactive treatment to proactive, precision, preventive based healthcare approach. And today we are going to talk about a question that I believe every dentist is asking themselves. Why should we implement salivary testing in clinical practice today? Not tomorrow, not in the future, today. Because the reality is simple. The patient sitting in your chair today is not the same patient dentistry was designed for 30, 40, 50 years ago. Lifestyle has changed. Medication use has changed. Stress levels have changed. Diet has changed. And all of these factors are directly affecting saliva. And here is the key idea I want you to reflect on today. Every single patient in our society, it doesn't matter if you are in the United States, in Brazil, in Europe, in Asia, all over the globe, every single patient is exposed to risk factors that affect salivary function. Yes, every patient. Let me show you why. And as we go through these examples, I want you to think about your own patients. And I would love to hear from you as well. So tell me here in the comments, which of these factors do you see most often in your clinic? So, dentists, let's talk about the modern patient. The modern patient is different, and the modern patient is exposed to multiple risk factors that directly affect salivary function. Let's start with something that has exploded in the last decade: vaping and e-cigarettes. Many patients today believe that vaping is a safer alternative to traditional cigarettes, but emerging research tells a very different story. Vaping does not only dry the mouth, it changes the biological environment of the oral cavity. Studies show that e-cigarette aerosols can alter the oral microbiome, increasing inflammatory responses, promoting the growth of more aggressive bacterial species, and even contributing to antibiotic resistance. In other words, let me make this very clear. A mouth that was previously healthy can rapidly shift toward a pro inflammatory environment. And what is even more concerning is the timeline. Research suggests that the oral damage caused by traditional cigarettes over several years may occur with vaping in as little as 6 to 12 months. And remember, many of these patients are young and they often appear clinically healthy, but biologically, their saliva and their oral ecosystem may already be changing. Now let's talk about another phenomenon that is rapidly transforming patient profiles worldwide: the rise of weight loss medications. Drugs such as Ozempic, Wegovy, and Rybelsus have become extremely popular. Many patients are now taking these medications to lose weight or manage metabolic conditions. But what many people do not realize is that these medications can affect the oral cavity. There are already reports in the literature and in clinical practice describing what some professionals are calling Ozempic mouth. Patients report dry mouth, taste changes, increased sensitivity, oral discomfort. And when salivary flow decreases, the entire protective system of the mouth becomes compromised. Saliva is not just fluid, it is a biological defense system. Without it, the risk of caries, erosion, and mucosal irritation increases significantly. Let's talk about something we see every day in clinical practice: diet. And recently, one of my patients told me something that stayed with me. She said, "Doctor, I actually don't keep water at home. We mostly drink Coca Cola." And she said it naturally, without realizing the impact of this habit has on oral health. Sugary beverages, soft drinks, energy drinks, they're all highly acidic. They challenge the buffering capacity of saliva and they create an environment that favors demineralization and erosion. But it is not only soda. Think about social habits. Cocktails, beer. Here in Brazil, it's very popular to drink caipirinhas. Wonderful moments with friends, but from a biological perspective, these repeated acidic challenges to the teeth. And again, saliva is the system that neutralizes these acids. When salivary function is impaired, the damage accelerates. Now let's talk about another group that many dentists do not immediately associate with oral risk: athletes. And I'm not only talking about elite athletes, and yes, in our work with professional soccer players, we monitor salivary biomarkers related to inflammation and recovery. We do this at Saliva Pro Sports. But the reality is that even recreational athletes face salivary challenges. During this intense training, athletes often experience dehydration, mouth breathing, changes in salivary flow. But also, during exercise, they may consume acidic sports drinks, which further increase the risk of enamel erosion. Saliva plays a central role in protecting the teeth and oral tissues during physical activity. When that protection is compromised, oral health can decline rapidly. Now let's talk about something affecting almost everyone today, even us, okay? Stress, burnout, sleep deprivation. Modern life is accelerating, and sleep is often the first thing people sacrifice. But sleep deprivation has profound biological consequences. Research shows that the lack of sleep can affect the immune system, inflammatory pathways, and yes, salivary composition. Saliva is deeply connected to the autonomic nervous system. Stress can alter salivary flow, change immune components, and weaken the oral defense system. This means that psychological stress can translate into biological vulnerability in the mouth. Yes, you're starting to realize why salivary testing in clinical practice is important, right? Let's not stop there. Let's talk about an important population that is often under recognized in dentistry. We just celebrate International Women's Day. Women going through menopause and perimenopause. During this stage of life, levels of estrogen and progesterone decline. These hormonal changes can affect the salivary glands. Many women report dry mouth, burning sensations, tasting alteration. The reduction of saliva flow during menopause can significantly impact oral comfort and oral health. And yet, the symptoms are frequently overlooked and misunderstood. The key question I want to go back with you is the statement we started with. Every patient in modern society is exposed to risk factors that affect salivary function. Do you agree? Look at this list. We just talked about vaping, medications, acidic diet, stress, sleep deprivation, sports, hormonal changes, and I even didn't even talk about systemic diseases and conditions. This is not a small group of patients. This is our entire patient population. So, why saliva matters? To understand why salivary testing is so important, we first need to remember what saliva actually does. Saliva is one of the most important biological fluids in the human body, not only in the mouth. It forms a protective layer over the oral mucosa and teeth, shielding tissues from environmental insults and supporting wound healing. It is essential for preventing dental caries, oral infection, erosive tooth wear, and saliva also regulates the oral microbiome. And that's why I mentioned it is important not only for oral health and systemic health, and it regulates biofilm formation. It plays a central role in enamel remineralization, and it supports critical functions such as speech, taste, swallowing. Saliva even influences the longevity of dental restoration. So, talking about saliva, let me drink some water. Patients with dry mouth may often experience reduced survival of restorations. This means that the salivary function is not only relevant for prevention, it directly impacts the long-term success of dental treatments. And salivary dysfunction is becoming increasingly common. Dry mouth, yes. Hyposalivation and xerostomia, which is the dry mouth feeling, are now highly prevalent conditions. One of the main drivers is polypharmacy. More than 1,500 medications are known to cause dry mouth. And this number is actually from a study from 2017 when we didn't even have Ozempic and all the weight loss medications out there yet. So After COVID 19, with all the stress we're facing, with all the new medications, for sure this number is even higher. There's even a study from the team at UCL in London showing that almost 40% of all medications are associated with dry mouth as a side effect. Studies also show that up to 30% of patients taking at least one medication experience medication induced xerostomia, dry mouth. But medication are only part of the story. Evidence now links salivary dysfunction to e-cigarette use, recreational drug use, lifestyle factors, stress, burnout, systemic conditions and diseases such as autoimmune disease, diabetes. Despite this growing prevalence, salivary dysfunction, dry mouth, is still underdiagnosed and undertreated, especially in older adults and in patients with chronic diseases. And when dry mouth is not addressed, it can significantly reduce quality of life and increase risk of oral disease. That's why there is a big opportunity here, and I want you to pay attention here with me. The opportunity of salivary testing. This is where salivary diagnostics becomes so important. Early detection is essential. Validated salivary tests allow clinicians to identify risks before symptoms appear. They help us identify high risk patients. They support personalized prevention strategies, and they allow truly individualized diagnosis, treatment, and monitoring. One powerful concept is the idea of establishing a salivary baseline. Imagine evaluating salivary flow and composition during a patient's first dental appointment. This allows you, my fellow colleagues, to understand what is normal for that specific patient. And this is key because the truth is that salivary reference values are extremely variable. But when we establish a personalized baseline, and we can easily do this, we can then detect subtle declines over time. And this transforms completely dentistry from reactive to proactive care. I want to go further with you today at this saliva cast because I want to remind you that saliva is often called the mirror of the body. It can serve as an early warning signal of systemic disease or physiological changes. Saliva contains a remarkable diversity of biological components: DNA, RNA, microRNA, proteins, metabolites, microorganisms. This means that saliva provides insights into both oral and systemic health, and it offers major practical advantages since collection is completely non-invasive, very simple, inexpensive. You can do it many times. You can easily do it in your clinical practice, at school, at university, at the clinical research center where I'm talking to you from right now. In fact, saliva has already proven valuable in detecting systemic diseases such as COVID 19, HIV, and even certain cancers. During the COVID 19 pandemic, salivary diagnostics demonstrated its scalability and practicality. We even were responsible for some of the publications and guidance towards this. And yet, despite all this potential, salivary testing remains underutilized in dentistry. Dentist, you have an opportunity here. If you're listening to this podcast, I want to invite you to join us in a global call for action. It is clear that we need stronger global efforts to advance both salivary research and clinical translation. We urgently need to implement salivary testing into our clinical practice. And if you're listening to this saliva cast today, you can be the first dentist in your region to do so. And you'll be recognized and more valued by your patients for doing so because the science already exists. The clinical applicability is already proven. What we need now is implementation. And this is exactly why I have created Saliva Pro. Through Saliva Pro, we have developed a clinical app available in English, Portuguese, and Spanish designed to help dentists interpret salivary findings and integrate salivary diagnostics for zero cost into their clinical workflow. The goal is simple: to make salivary diagnostics accessible, practical, evidence based in clinical, real clinical practice. And the app is available free of charge for dentists who complete our training. So if you're interested in implementing salivary diagnostics in your clinic, you're very welcome. Congratulations for taking this step forward towards a more proactive and science-driven dentistry. You can contact me directly at Deborah, Debora, at salivapro.com. I would be happy to help you start this journey. Dentists, the message is simple. And I can see you're commenting here, Nick. So nice to see you. Individualization is future. The patient has changed. The risk factors have changed. And our diagnostic strategies must evolve as well. Salivary testing allows us to detect risk earlier, personalize prevention, and provide better care. It is not only about treating disease, it is about monitoring health. If you enjoyed this episode of SalivaCast, I invite you to like it, to share it with your colleagues, to follow me on Instagram. I have two different Instagram accounts. One I just recently created, all in English, is at Dr. Deborah Heller on Instagram, and my older, most popular account, A Dentista Cientista, on Instagram. There, I share daily practical, evidence-based insights on salivary diagnostics and preventive dentistry. And if you're a dentist interested in implementing salivary diagnostics in your clinical practice, I would love to help you. You can contact me directly at Deborah@salivapro.com. Thank you for being here. And remember, listen to what your patient's saliva is telling you. See you at the next episode of SalivaCast.